If you've been struggling with your fertility, whether you're dealing with PCOS, insulin resistance, weight that just won't budge, or irregular cycles, you've probably heard about GLP-1 medications. Ozempic, Wegovy, maybe even Mounjaro. These drugs are all over the news, all over social media, and maybe even all over your doctor's waiting room. And I bet you've wondered, could one of these medications help me get pregnant? It's a fair question. It's actually a really important question. And today, I'm going to give you a real, honest, thorough answer. Not the kind of oversimplified response you're going to get from a quick Google search, and not the kind of generic warning label answer that leaves you more confused than when you started. Because here's the truth. GLP-1 medication sits right at the intersection of metabolic health and reproductive health. And that's exactly the intersection where I work every single day. I'm Dr. Marc Sklar, the fertility expert. For over 24 years, I've worked with women all over the world to identify the real root causes of their fertility struggles and help them build a path to pregnancy that actually makes sense for their unique body. And in the last few years, GLP-1 medications have become something I'm asked about consistently. So today, we're going to cover everything: how these medications work, when they might actually support your fertility, why the official guidance is to stop them before you start trying to conceive, what the emerging research says about stopping them, and most importantly, what the approach actually looks like if you're dealing with metabolic issues that are affecting your ability to get pregnant. By the end of this video, you're going to have a clear picture of where GLP-1s fit and don't fit in your fertility journey. Before we dive in, I want to make sure you have something in your hands today that can help you start taking action. I put together a free guide called The Proven 6 Ways to Improve Egg Quality in 90 Days. If egg quality is something you've been thinking about, and for most of the women watching this video, it should be. This guide is going to give you a clear, practical starting point. To grab it free, use the link in the comments or the description of this video. It takes 2 seconds and it could make a real difference in your next 90 days. Now, let's talk about GLP-1 medications and what they actually mean for your fertility. Let's start at the beginning, because I know not everyone watching is fully up to speed on what these drugs actually are. GLP-1 stands for glucagon-like peptide 1. These are receptor agonist medications, which means they mimic a hormone your gut naturally produces when you eat. That hormone signals to your pancreas to release insulin, tells your brain you're full, and slows down how fast your stomach empties. The result? You eat less. Your blood sugar stabilizes, and over time, many people lose significant weight. Semaglutide, which is the active ingredient in both Ozempic and Wegovy, is the most talked about version right now. Ozempic is technically approved for type 2 diabetes management. Wegovy is approved specifically for weight management. And Mounjaro works on a similar but slightly different mechanism. These medications have been genuinely groundbreaking for many people. There's really no question about that. Weight loss that was previously almost impossible for some individuals has become achievable. And in some cases, that weight loss has had meaningful downstream effects on hormones, cycles, and yes, fertility. But here's where it gets more complicated. And this is what I want you to really understand. These medications were not designed for people who are actively trying to conceive. They weren't studied in that population. The official labeling says to stop semaglutide at least 2 months before a planned pregnancy because of how long it stays in the body. So the question isn't really, is Ozempic good or bad? The better question is, how does the metabolic work these medications support connect to your fertility? And what's the right approach if metabolic health is at the root of your fertility challenges? That's the conversation that I want to have today with you. Here's something that might surprise you. For some women, being on GLP-1 medication can actually restore ovulation. And that's not a marketing claim. There's real research behind it. The connection runs through insulin resistance. Insulin resistance is one of the most underdiagnosed and underaddressed drivers of fertility challenges, especially in women with PCOS. When your cells stop responding properly to insulin, your pancreas has to pump out more and more of it to do the same job. And those chronically elevated insulin levels send signals to your ovaries that disrupt the normal hormonal cascade that leads to ovulation. What we often see in women with PCOS and insulin resistance is that the ovaries start producing more androgens, testosterone, and other male hormones in response to the elevated insulin. And those elevated androgens are a big part of why ovulation becomes irregular or stops altogether. GLP-1 medications help break that cycle. By reducing insulin resistance and supporting weight loss, they can lower circulating insulin levels, which in turn can reduce androgen production and allow ovulation to return. A meta-analysis looking at GLP-1 use in women with PCOS found improvements in menstrual regularity, metabolic markers, and even pregnancy rates. And I've seen this anecdotally in many of the women I work with. When we get the metabolic picture under control, the reproductive picture often follows. One of my HOPE program members, Danielle, had been told for years that her fertility challenges were primarily about her weight. She had PCOS, thyroid dysfunction, and recurring losses, but her doctors kept circling back to weight as the main answer. When we finally addressed the root issues together, the insulin resistance, the thyroid function, the inflammation, her cycles regulated, her ovulation improved, and she was able to get pregnant. It wasn't magic. It was actually understanding what was driving the problem. Now, and this is important, GLP-1s can be part of the picture that gets the metabolic groundwork done, but they are a tool for the preparation phase, not for the trying to conceive phase, and not for pregnancy. That distinction matters enormously on a fertility journey. Let me be really clear here, because this is where I see a lot of confusion online. The official guidance from the prescribing labels for semaglutide, Ozempic and Wegovy, say to stop the medication at least 2 months before a planned pregnancy. That's a 2-month washout period based on how long semaglutide stays in the body. We're talking about a drug with a long half-life that takes time to clear. Now, some of you might be thinking, but what if I get pregnant while I'm on it? What does the research actually show? The most robust data we have right now comes from a prospective multi-center study published in BMJ Open in 2024, looking at the first trimester GLP-1 exposure. And here's the somewhat reassuring news. When they compared outcomes in women who were inadvertently exposed to GLP-1 medications in the first trimester against comparison groups, they did not find a significantly increased risk of major birth defects or pregnancy losses. But, and this is a big but, the sample sizes are still limited. And this is not a green light to stay on these medications once you know you're pregnant. The researchers themselves were clear. We need larger studies. And the current guidance is to stop, and that remains in place. So if you're on a GLP-1 right now and you're actively trying to conceive, the answer is straightforward. Talk to your prescribing physician about transitioning off of it. Give your body the full washout window and make sure you have a plan for what happens next, because this is where things get genuinely tricky. Rejuva was designed to support egg and sperm health from the inside out. More vitality, more cellular strength, more fertility potential. It helps unlock better fertility by improving cellular energy, hormone balance, and overall reproductive wellness. Get yours using the link below. This is the part of the conversation that most people are not having, and it's one of the most important fertility implications of GLP-1 use. When you stop a GLP-1 medication, especially if you've been on it for a while, what often happens is what I call a rebound effect. Your appetite returns, sometimes intensely. Weight can come back quickly, and with the weight often comes the return of insulin resistance and the hormonal disruption that goes with it. In November 2025, a study published in JAMA looked specifically at what happened to women who discontinued GLP-1 medications before or early in pregnancy. The findings were striking. On average, these women gained significantly more weight during pregnancy than comparable women, and they had higher rates of gestational diabetes, preterm delivery, and hypertensive disorders of pregnancy. Now, this is an observational data. We can't draw a direct cause and effect line from these numbers, but what it's pointing to makes biological sense. Think about it this way. GLP-1 medications suppress appetite and reduce insulin resistance. Stopping them can mean a rapid return of appetite and a worsening of insulin sensitivity. And then you add pregnancy on top of that. Pregnancy itself is a naturally insulin-resistant state. The combination of metabolic rebound plus the metabolic demands of pregnancy can create a perfect storm for some women. This is why I always say, the goal isn't just to get pregnant. The goal is to get your body genuinely ready for pregnancy. A strong metabolic foundation, not just the temporary suppression of symptoms by medication, is what's going to serve you and your pregnancy best. And this is exactly what the HOPE approach is designed to do. When we assess what's actually driving your metabolic challenges, whether that's insulin resistance, thyroid dysfunction, inflammation, gut health, adrenal stress, and we address those root causes systematically, you're not dependent on a medication to maintain that improvement. We've actually shifted your physiology. So let's get practical. If GLP-1 medications aren't the answer for the actively trying to conceive phase, what actually is? The first thing I want to say is, if you have significant insulin resistance, if you're carrying excess weight, if you have PCOS, these are real addressable fertility factors. They're not things that you should be told to ignore or just to push through. And they're not things that only medication can address. Let me walk you through the approach that I use with my HOPE program members, because it's the same framework whether or not someone has been on a GLP-1. The first priority is blood sugar regulation through diet. And I don't mean a restrictive, miserable diet. I mean a strategic eating pattern that keeps your insulin levels stable throughout the day. That means prioritizing protein and healthy fats at every meal, limiting refined carbohydrates and processed foods, and eating in a way that supports steady energy without the blood sugar spikes and crashes that worsen insulin resistance. One member in our HOPE program, after years of being told to just eat less and exercise more, started working with me on her metabolic picture. Within a few months of implementing a targeted nutrition approach alongside specific supplementation for insulin sensitivity, things like berberine, inositol, and targeted omegas, her cycles became regular for the first time in years. That's the power of actually addressing the root cause instead of masking the symptoms. The second piece is movement, but again, strategic movement. Strength training is particularly valuable for insulin resistance because building muscle mass directly improves insulin sensitivity. Even 2 to 3 sessions per week can make a meaningful difference in your metabolic markers over 90 days. The third piece is what I call metabolic testing. And this is where functional medicine really distinguishes itself from conventional care. We're not just checking fasting glucose and calling it a day. We're looking at fasting insulin, hemoglobin A1C, a full lipid panel, inflammatory markers, hormonal profiles, including androgens, and thyroid function. We need the full picture to know what we're actually working with and working towards. And here's the thing about testing. It's not just about diagnosing a problem. It's about giving you a baseline so that we can measure real change. So we can see your insulin sensitivity improving, your androgen levels dropping, your cycles regulating, and know that the work we're doing is actually moving the needle for you. If you've been relying on GLP-1 medications to manage the metabolic factors affecting your fertility, or if you're trying to figure out what's really driving your challenges, I want to invite you to book a fertility assessment discovery call with my team. This is a personalized one-on-one call where we look at your full fertility picture, your labs, your history, your cycles, your symptoms, and map out a clear path forward. It's not a generic consultation. It's a real assessment of what's going on in your specific case and whether the HOPE program is the right fit for you or not. The link to apply is in the description below. These spots are limited, and we do review applications to make sure it's a good fit. So if this feels like your next step, don't wait. Let me leave you with a quick recap of what we covered today. GLP-1 medications like Ozempic and Wegovy can support fertility indirectly by improving insulin resistance, reducing androgens, and supporting weight loss in women with PCOS and metabolic challenges. For some women, that improvement has led to restored ovulation. But the official guidance is to stop these medications at least 2 months before actively trying to conceive. Semaglutide has a long half-life, and it's not recommended during pregnancy. The emerging research on metabolic rebound shows that stopping GLP-1s can lead to rapid weight regain and worsening insulin resistance, which underscores why the goal should never just be to suppress symptoms with medication, but to genuinely address the underlying metabolic drivers of your fertility challenges. And the good news is, those underlying drivers are addressable. With the right assessment, the right personalized protocol, and the right support, your metabolic picture can change, and your fertility picture can change with it. If you haven't already, go to the link in the comments to get my free egg quality guide. And if you're ready to stop guessing and start getting real answers about what's blocking your fertility, I want to personally invite you to book a complimentary fertility assessment with my team. On this call, we'll take a deep dive into your unique fertility journey. We'll uncover potential roadblocks that might not be obvious. This is a genuine opportunity to get expert guidance on your specific situation and to see if the HOPE program is the right fit for you. So, if you want to have me as your fertility coach, the link to book your assessment is in the description below. Don't wait on this. Your fertility journey doesn't have to be this hard, and you don't have to do it alone. And make sure you watch the next video I've linked, because it goes deep on something that affects so many of the women that I work with. The signs you're losing your fertility and exactly how to fight back. That video has helped thousands of women understand what's actually happening in their bodies and what to do about it. I think it's going to be really valuable for you. So check it out. As always, stay hopeful, stay informed, and stay fertile.